The Sinai Medical Foundation Oral History Project is being conducted by the Leonard M. Simons Jewish Community Archives. My name is Brian Chambers, and today's date is January 10th, 2024. I am interviewing Dr. Louis Clayman. Dr. Clayman, do you give permission to the Leonard M. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for the use as deemed appropriate by the archives?
I do.
Excellent. Let's start with a little background information. Can you tell me a little bit about your early life and where you were born?
Brooklyn, New York. And now here is a very unexpected, serendipitous discovery. Eli Brown was the chairman of anesthesia at Sinai Hospital. And I was going over his education one time with him when I was doing my rotation, and then sometime later. And I found out that in 1947, he was an intern at Brooklyn Jewish Hospital. And I was born there in 1947. So I said, hey, by the way, by any chance, did you assist in my delivery? So, of course, that was not the case. But it's funny that we go back, for such a long time that there's some kind of connection where we all wind up being at Sinai, many years later. So I grew up in Brooklyn. I went to James Madison High School and Brooklyn College. I went to the East Midwood Jewish Center, the Hebrew school, until I was in the 12th grade. And it was an interesting time. Growing up in Brooklyn was actually wonderful. We lived in an apartment house. There were 84 families. There was always somebody to play with. It was really very nice, especially in retrospect. And then from there, after Brooklyn College, I went to dental school, as you know, at Harvard, and then did my residency in oral and maxillofacial surgery at Sinai Hospital in Detroit. After which, I went to medical school with advanced standing, so I could do medical school in a couple of years at Hahnemann, which is now Drexel University. Then I did an anesthesiology residency for a year. And then that kind of brings me up to, where we are today.
To kind of put us in a temporal location, when did you graduate from Harvard?
72, 1970.
Okay, excellent. And then you started your residency at Sinai in what year?
72.
70. Oh, at Sinai is 72. That's right.
72 to 76.
Excellent. Now to go back a little bit, who were your inspirations to become a doctor, and what specifically drew you to oral and maxillofacial surgery?
I decided I was going to be a dentist when I was 11. My favorite uncle, his name was Phil, was my dentist, and he used to do whatever I needed. I used to get fillings done. I never had any local anesthesia or anything. It was no big deal. Dentistry was just fun. And then I would stick around and watch him work on patients. And I thought that was really cool. And then after he was done on working on me, we would go out and have lunch together. So it was great. He was kind of my idol when I was a kid. You have your dad and you have your second dad. And that was my uncle. So I decided I wanted to be a dentist. And I followed through on that all the way. And I went to dental school, as you know. And we had a different life at Harvard compared to other dental schools, because the first 2 years were not at the dental school, we're actually in the medical school faculty. So we were part of an assimilated group of the medical students and the dental students. So we really had the medical education for the first 2 years. Then third year, we're full-time in the dental school. And we did a rotation. It was set up just like medical school. We did one rotation on endodontics, one on prosthodontics, etc. And I'm going through all these nice rotations doing dentistry. And I said, I'm not sure I really want to do this. And so I had some doubts. And then in August of 1971, I did my oral surgery rotation at Massachusetts General Hospital. And my mentor, my first year, was Walter Gorelnik, who was the chairman of oral surgery at Harvard and at Mass General. And he was a very stimulating guy, very, very clever guy. One of the people who was involved in the original standardization of oral surgery programs, etc. And when I got there, we were taking call with the residents and interns who were up all night, doing emergencies. And I said, this is what I want to do. This is fantastic. I've got to do this. And I did. And then my last year, I was interested in pathology, so I did a 3-month rotation in Copenhagen with a very well-known oral pathologist. And I did all the rotations that went along with what you'd want to know to be a surgeon. So it was really a fun time. So I found what I really like. So I was really very happy until, I'm 76 years old and I still work 4 days a week. And I love it. I did the right thing. It's great if you could find some work that doesn't really feel like work. I tell my patients, I've never had a job. I just enjoy my work. And that's how I still feel about it.
Excellent. So to go back to your residency at Sinai, can you describe what that experience was like?
This was a great shock. Being a student, we thought that was hard. As we like to say on the street, man, you ain't seen nothing until you become a resident. there's no hard in school. School is vacation time. So Dr. Gorelnik, who I had mentioned before, when I was applying, I said to him as my mentor, I said, I'm not sure where to go to try to apply for residency. He said, there's a place in Detroit called Sinai Hospital in Detroit. The chief is a guy named Herb Bloom, and nobody knows about this place. But I know Herb because we sat on the committee that created the Essentials. That's the document that guides how a residency program should be back in the early 1960s. And they have a really good program over there. Why don't you go apply, see what happens? So I did. And I wound up being accepted. They took one resident a year. It happens to be that year it was me. So we had a 4-year residency with one resident per year. And we did about 350 cases a year in the hospital, and we did a clinic. So we were busy all of the time, and it was intense. And it was actually, in retrospect, wonderful. But going through it, it was a bit trying. However, it was also great because there was no allowance for being slack, for not being prepared, for not doing it right. And there was no such thing as an excuse for not showing up. It just didn't happen. To such an extent that when we'd have these snowstorms and stuff, I skied to work one day to get in from 8 Mile and Telegraph. I got on my cross country skis. I got to work. I don't know why I did. Nobody was in the hospital anyway, but that's the kind of motivation that we had. We were always there. So it was tough, but it was like tough love. There was no excuses. Everybody had to perform at a high level. And if you got chewed out during the day because you made some dumb move, at the end of the day, we kind of got back together. So there was nothing that was, bullying or negative. It was, look, this is what we want you to be. And you have to act this way to be a surgeon. This is what it's all about. And I'm sure it was the same way in general surgery and in oral and maxillofacial surgery. It was a very high standard. And you just had to meet that standard. And for the most part, we did. And everybody who's come out of that program who successfully finished it has actually done extremely well in life following it.
Now, after your residency, you went to Hahnemann and then another hospital in West Virginia. Tell me about that experience and what drew you back to Sinai.
Well, first of all, getting to West Virginia was interesting because here I am working at Sinai and I'm going to finish. I'm going to graduate. Now, what am I going to do? The logical answer would be, you could consider getting a job. That might be what most people do when they finish residency. And I said, nah, let's go do some more education instead. So that's when I went to Philadelphia and did the medical bit and anesthesia. And when I was done with that, I needed to get a job. And I really had never thought about it. Like a lot of my residents that I trained, they knew where they wanted to go, what street they wanted to be on when they were done. All I knew is I wanted to go somewhere. And it turns out that my chief, John Helfrich was his name, knew some people in West Virginia who were quite good. So why don't you give these people a call? And I did. And I wound up going to West Virginia, and I was the director of the oral surgery program they were trying to create at Marshall University in Huntington, West Virginia. And I was also in private practice there for 6 years. Going into the 6th year, John Helfrich left in 1984. There was a void. There was a temporary chief for 15 or 18 months in between him and me. And one of our attendings, a guy named Erwin Small, suggested that maybe I would be a good choice to come back as be the chair. And my big supporters to come back were actually Erwin Small and Eli Brown and a few other people working behind the scenes, whom I didn't even know were working on my behalf. So I came back to Sinai as the chairman in October of 1985. So I was in between, I was in West Virginia for 6 years. And I couldn't wait to get back to Sinai. That was a dream. When I was in residency, one day I took out a yellow pad and said, what do I want to do in life? This is after I got married. My professional goals. One, I wanted to be the chairman of a residency program. I wanted to teach. I wanted to write a book, and I wanted to be president of the American board. Modest goals for a 28-year-old kid, right? Well, over a period of time, I accomplished the first two, but I was an examiner for the board, but never got to be the chairman. And I thought being focused in that way was, that part of my life was kind of set and secure. I love the academic piece. I love taking care of people, and I just love doing surgery. And I like writing too. So you keep your brain engaged and you keep the involvement that is clinical, that keeps you fresh and keeps you enthused and makes you love the profession. That's what I did.
And so you ended up coming back to Sinai. Can you tell us about the culture of Sinai when you came back as a director and how that differed from your residency? I'm sure there's many ways it did.
Yeah, things change with time. My original chairman, Herb Bloom, was out by then. In fact, my first year, we didn't like some of the things he was doing, and we had a little rebellion. And eventually, he resigned, and we had an interim chief, a fellow by the name of Fred Henney. And Henney was one of my mentors. He had been the chairman at Henry Ford Hospital for 35 years. He left there after a big fuss about privileges and came to Sinai and brought with him doing oncology at a very high level. And he was a fearless surgeon and one of the founders of the International Oral Surgery Group and past president of the American Board and the American Association. He was the top of everything and a very wonderful guy. And he was a very strong mentor. And he was a great aide and a person who shifted the training program from being trauma-based and infection, along with some cleft surgery, into expanding into doing more involved maxillofacial surgery. So the shift had commenced in the 1970s of changing from the old classical 3-year residency that basically did trauma and took out teeth all day long into a real hospital service like ENT would be or plastic surgery. Very, very similar. And in fact, Sinai actually was a 4-year program in the 1960s, and it didn't become the standard until the 1980s. And that's what I mentioned earlier, Dr. Bloom and Dr. Gorelnik have been part of the committee that created these essentials. So by the time I got there, as I came back, the scene had changed. It was a full integration into the hospital, even more than before. And we were highly respected, rotating on all the different services, on medicine or anesthesia or surgery. And we were treated just like all the other residents. It didn't matter that we were dentists. We were physician and training and all of it, the same. Wonderful thing about Sinai. You just had to be recognized for how you did your work. It didn't matter where you came from, what you looked like, or what your degree was. You just had to be on top of it. And that's what it was. So when I came back, that attitude still prevailed. And I pushed it, even some more. And we continued to expand. We're doing a wider and wider scope. And we maintained the very good relationships with the services the residents had to rotate on, who are our colleagues in surgery, in medicine, and in anesthesia. And that was wonderful. Also, we continued to at least attempt to do the research piece. So I have to go back a bit to a question you're probably going to ask me later about research. Sinai was absolutely extraordinary as a private, non-university hospital to have its own research wing. We had a building. It was the research building. It was run originally in my time by Piero Foa, who was originally from Milano, from Italy. It's a dual degree guy, MD, PhD, outstanding researcher, and I believe that glucagon was, his area was in diabetes. And we had this hospital research building. Adrian Kantrowitz had a lab there. His left ventricular assist device was developed at the research building at Sinai Hospital. We had to do research in oral surgery because we also were doing a master's degree program in physiology at Wayne State University. So every year we had to present at research day, and we were supposed to write a thesis and get a degree. Well, a lot of people did the course, but only about 4 of us ever did a thesis. It's another story, but at least some of us did, and it was fine. And if we have time, I could tell you a story about that. In the research building, I met a young PhD named Terry Fuller. And Terry Fuller had a PhD in, I think it was in physics from University of Massachusetts. And it was his first job. He was at Sinai. And I had to do this research project. And we had this really cool new device to play with called the laser, carbon dioxide laser. So I did a study of how wounds heal when treated with a laser to make a cut, to do an osteotomy with a laser. Excuse me, let's just turn that off for a minute. And I was able to probably do what was the world's first study of how bones respond to lasers. And it was published in our journal. And I had a great time with Terry. And here's the amazing thing about Sinai. We're working really hard all day long. We stay till 8 or 9 o'clock almost every night. I convinced Terry to make himself available a couple of nights a week for about 3 months so we could do the animal experiments starting at 8 o'clock at night. And we worked from like 8 until midnight because he had to continually adjust the laser, which he had actually made. It was not like a commercial laser that we have today. We had to do a lot of hands-on management and got through the project. So that was a wonderful experience. I hated it while I was doing it, but later on I thought it was wonderful. And we had a similar thing with a few other residents that came afterwards that were doing some interesting physiologic experimentation involving Joseph Krakauer, who's the medical physiologist. He was a physician who worked with Adrian Kantrowitz. So we had this wonderful research activity that was really high level. Quite a few papers were published, a lot of awards were received, and it was a really wonderful thing. And when that went away with the hospital, I think the whole tenor of the hospital changed somewhat. It made a private hospital much more like an academic institution that's doing really great clinical care. And that's a very hard combination to achieve. It's even difficult to achieve in a university, in my opinion.
Now, one of the other defining features of Sinai was that it was a Jewish hospital. And as a Jewish doctor, what was it like working at Sinai compared to other hospitals that didn't place as much emphasis there?
Well, first of all, there were a lot of people who just like yourself. That's immediate comfort. Whether you're black or yellow or orange or pink, if you have people that are the same, you immediately have a little bit more comfort zone. Plus, a lot of people have been through similar experiences, and a lot of them through much worse experiences than I ever had. We had our goal, the single requirement to come to Sinai wasn't being Jewish. It was, you know why the hospital was created. I won't go over all of that. So it was a comfortable place where no one was going to kick you out or find some fake reason to eliminate you because you were Jewish. We didn't have that to worry about. But we took people from all over the place, a lot of whom, the majority of whom at that time were Jewish, but they were from everywhere. And some of my best friends and colleagues and really exemplars of how to do good medicine. Leo Eisenberg, Eduardo Phillips, they came from Mexico. They were the best people you could ever imagine and what they were doing and how they conducted themselves as human beings. It was a great example. And we had other colleagues who were from India, Iran, Israel, the Malinowskis from Poland doing fellowships, one fellow from Indonesia who became a GI guy, everybody at a high level from all over the place. The majority were Jewish, but not everybody. And the relationships were great. One of my closest friends among the people ahead of me, older guys, was Harold Perry, who was head of radiation oncology. He was a black guy who grew up in Hamtramck. I was a pallbearer at his funeral. I mean, that tells you something about how people reacted. And we just were all on a similar plane and how to behave and what our intellectual concepts were, as well as the human ones. We took care of everybody. We didn't care who they were, what they looked like. We treated them all well, and we treated them to a high standard. If you were rich or you were poor, you still got treated the same way, at least in oral surgery. And I'm sure it was like that through the rest of the hospital, too. That was special about this place.
Thank you. Looking at what else was special, could you tell me a little bit about the things that made Sinai so special in particular to you? What were your favorite parts of working there on a daily basis?
Respect, especially in comparison to the rest of the world. We had already won the fight as dentists working within the hospital to be respected just like the physicians were. And there was a very high awareness of what that role was and how it needed to be maintained. And that was very comfortable. When I left to go to medical school, I also worked. I got my boards while I was doing my anesthesia residency in medical school and all that. But I also had privileges at some of the hospitals in the Philadelphia area. They had never seen oral surgeons out in the suburbs around the city of Philadelphia. That's not in the city, it's in the suburbs, who had done any of the stuff that we had done at Sinai. And we don't have time to go through all the stories on this tape, but let's just say that I was able to garner a significant amount of respect for what oral and maxillofacial surgeons could do, so that they would start to not think about us, oh, they're the dentist in the hospital. You know, we were just a colleague. But as we had accomplished at Sinai, this feeling of security and respect at that time was unique. I mean, that's not the only place that was like that, but most places were not like that. And what was very special was whenever one had a problem, there was always somebody to talk to. There was a shoulder to cry on, and there was an ear to listen to what you had to say. And before doing something rash in response to a negative experience, it was a really good idea to talk to our friends and colleagues so we didn't do anything really dumb that would hurt us later. And we had a lot of that. And, we were young. But, I was younger than most people because I graduated from school kind of early. And, I was a bit immature. So it was nice to be able to have some people who could settle me down. And that was wonderful. It was great. You just don't have that everywhere. That's representative of how Sinai was. And it was very much inclusive. The people who came from elsewhere, the non-Jewish Indians, most of the Iranians were Jewish, but the Indians, Pakistanis, some of the people from different parts of the Mideast, they were treated exactly the same. There was no difference. And it was a very good example of how to be in life. It was really nice. That was very special.
Conversely, looking at some of the areas of Sinai that were not as enjoyable to encounter at work, some of your least favorite aspects of Sinai.
Well, as I said, things change. In the beginning, the only problem that we had was our chief because he was a little bit difficult to deal with. We got over that. We got a good education. We carry on. I come back in 1985. By the time we get to about 1992, 1993, the world is already shifting a little bit. This unfettered attachment to hard work, hard discipline, there's no quit. It starts to soften. And we find that we're starting the shift towards the 80-hour work week. And, doctors shouldn't work too hard because they're tired and they make mistakes, which is true. But the whole shift starts to come towards shifting responsibility. When you're done, you don't have to worry about things anymore. Somebody else will take care of it. We were taught that, that's our patient forever. If they call in the middle of the night, it doesn't matter. We've got to take care of them. That starts to change. At the same time, in order to build this beautiful hospital residency that nobody knew about, I thought it'd be a good idea if people found out about us. So we needed to start publishing. Well, that met with a great deal of resistance because that requires a different kind of work. So we really never published very much. I mean, there were only two people who published anything. One was Bruce McIntosh, who was my right-hand man when I was chair, and who was one of my mentors originally. He came to the hospital with Fred Henny in the 1960s, and he had published and I had published. And that was about it. So I was never able to accomplish that because of the internal resistance from my own staff. Later on, as they get into the 2000s, everything starts to change. We had a very nice time from 1985 to about 1994. Now the economics in Detroit completely shift. The hospital reassociations and closures and reorganizations and conglomerations and all that begins. And the absolute money drive behind medicine changes significantly. So that at one time we had this ability to be really quite independent and just do the right thing all the time. We're still trying to do the right thing all the time, but it gets more difficult. And that was really negative and ultimately resulted in the loss of the hospital completely. So there's no way to sugarcoat this. Between good planning, bad planning, I don't want to point any fingers at anybody. There was a problem going on that's bigger than Sinai. The whole Detroit, Southeast Michigan situation changes. Later on, we have the city of Detroit going into bankruptcy. What more can I say about how dire the economic circumstances were? And those things created shifts in how things worked within the hospital. And then we become part of the Detroit Medical Center. And we have all these discussions about what should we do when we sell the hospital. I was on the staff executive committee at the time that all this was going on. Bob Michaels was the last president of the SEC. I was the last vice president. Ron Trunsky, who was associate chair of psychiatry, had just come off. And we're going through a torturous time of trying to figure out what to do. Fortunately, some really brilliant people, namely guys like Gaylord Alexander and Eli Brown, and probably Saul Sakwa, Eduardo Phillips, I don't know everybody, but the people who were in the Education Corporation, going back to the beginning when we treated charity patients, that money went into a fund for resident benefit, for education and books and stuff like that, called the Education Committee. It was incorporated before the sale of the hospital. That's why we have a Sinai Medical Staff Foundation today. That was from the Ed Corp. What other private hospital would give their monies for educational use and enhancement, make a corporation to hold it so it remains secure no matter what happened to the hospital? That was incredible foresight. And I thank all those people for thinking so well about what could be and what might be, and ultimately what did happen. Hugh Beckman was part of it also in ophthalmology. And you got me going. What else did I want to say on that?
Well, I wanted to kind of go back to around the time of the sale of Sinai to DMC. I was wondering when you first initially heard about that. Were you part of any committees at that time?
Well, I was on the staff executive committee, so we knew what was going on with the hospital, but I wasn't involved in the actual discussions about the sale or anything like that. But we all had many discussions about what to do. Hugh Beckman had a meeting of all of us at his home when this was all starting and trying to plan out what to do, raise money, buy the hospital ourselves, all different kinds of different combinations. And that goes back to probably around the middle 1990s, I guess. I don't remember exactly. I do have a problem recalling the dates because I've suppressed a whole lot of the stuff that happened. I just filed it away in a place I don't want to revisit. It was difficult. As far as the residency itself went, we're talking about merging with another hospital. We had discussions with Henry Ford Hospital. We didn't want any part of Henry Ford Hospital. I didn't want any part of Henry Ford. We had a choice between going to a commercial group like Tenant or one of those, or going to the Detroit Medical Center with Wayne State. And ultimately, it was Detroit Medical Center, at which point we merged the staffs between Sinai and Sinai Grace, and New Grace, which used to be Mount Carmel, which is where our residency program first started in 1949, before there was a Sinai. And then the two became the Sinai program, Sinai Mount Carmel. And that was a tough time because it was like working with one hand tied behind your back. We were unsure about the amount of educational support we had. The hospitals involved became different. We had this new entity called Sinai Grace, and we moved into Sinai Grace Hospital when Sinai closed. That was all different. Grace had a completely different culture. DMC had a totally different culture from Sinai. And in the oral surgery world, where there were 5 residencies in Southeast Michigan, University of Michigan, Sinai, Henry Ford, who am I leaving out? Detroit Receiving Hospital, and Sinai. Excuse me. And there was a lot of competition between all of them. But because of the commonality of training and a lot of the people in all the different programs, socially, we had a pretty good relationship. We even had regular meetings of something called the Detroit Academy of Oral and Maxillofacial Surgery, where people from all the different programs would come together. And we had a very social, nice dinner, and everybody got along. For people who were in competition, in economic or academic competition, it was very cordial until it all blew up in the 2000s. It all ended. Last time I was back in Detroit to give a talk about 5 years ago, none of this stuff really even happened anymore. The Detroit Academy was not functioning, and the programs, Henry Ford was closed. I had moved our affiliation, so I didn't want to be affiliated with the program being run by the DMC either. We moved to St. Joe's in Pontiac for a few years. Then later on, Henry Ford came back at us, and they wanted me to combine the program with Henry Ford, and then that fell apart. And finally, I said, that's enough. I'm done with this education thing here. And we moved under Bruce McIntosh's guidance to the St. John Macomb Hospital, which is where the residency now is. It's no longer a Sinai. There's no more Sinai residency. It all changed between 2000 and 2010. And then I left in 2010. I moved to California.
Thank you for recalling all of that for us. As you reflect on your time at Sinai, who are your major mentors that you really want to highlight for this interview?
One was my original chief, Herb Bloom, who was a really tough guy to deal with, but a really intelligent man with an amazing administrative skill, who is actually one of the founders of Sinai Hospital. And he really plugged me into the whole culture, going back to who his relatives were and how they were all related and how they started the hospital and what all the interconnections were. It's really pretty fascinating. And a very high academic standard that no matter what, you went forward with it. When he left, Fred Henney was the acting chairman for about almost a year and a half. And he was a tremendous mentor from then until the time that he died, about 7 or 8 years later. Brought an entire new scope to the practice and a very dignified way of dealing with the patients and how to act under duress administratively, how to follow your principles and not to cave in, which is how he came to Sinai. He had a privileged fight at Ford Hospital, and the chief of surgery is I won't mention his name, but he was a vascular surgeon. They essentially fired him because he said, well, you're doing radical neck dissections. You're a dentist. You have no business doing this. He said, okay. And the board didn't support him. But later on, they did. They restored his privileges. So we'd like you to come back to be the chair. And we'll have a meeting to do that. So he went to the meeting. He listened to everything they had to say. They gave him a new contract to take over. And he said, thank you very much. Took a letter out of his pocket. This is my letter of resignation. I can't work with you people. I'll never forget that. And he came to Sinai. This is a guy who spent his life, 35 years, running as the chairman at Ford. No private practice experience or anything. No future set for him, and just quit. Erwin Small gave him an offer to work in his office. He worked in his office for about a year. And he said to Dr. Small, said, Erwin, I really appreciate your offer, but I just can't work for anybody. I have to do this myself. And he did. And he started his own practice, and he carried on almost until the time he died. He had a heart attack, triple bypass in 1972, early 72, and he pretty much had to stop after that. But he was a great mentor. I mean, talk about a guy who followed his principles, stuck by his guns, and was able to deliver the goods. He had the skill and the intelligence to do everything. The other one was his associate that he brought with him, Bruce McIntosh. And Mac has been my closest, professional friend in the field since, 1972. And this is, 50 years later. I still talk to him fairly often, not as often as I like. He's retired. He's 88 this year. And I always remember his birthday because it's like 2 months from Sandy Koufax's, about the same time. And he was great, very supportive. And when I was the chair, he was my right-hand man. He helped with a lot of different things. And he was a good person to chat with, about planning things and doing the surgery correctly and working with the residents and enveloping the residents and being at the school. I was also the chairman at University of Detroit Mercy for 5 years. And Bruce was also on staff for a long time and was able to get the residents and the students to do a little bit of academic activity that, I didn't have time to do. So he was really very, very helpful and very supportive, until this day. So those are at Sinai, those are the people. And I've had other people I respected in different areas and different times of my life. But at Sinai, those are the key people right there.
Excellent. And are there any final points that you wanted to highlight about Sinai in general? Any further points that you want to touch on?
Yeah, I would say one thing about Sinai that you don't feel it everywhere. And we certainly didn't feel it at Sinai Grace. There was a lot of angst, racial angst and all that kind of stuff that was going on. When I was a resident, we had people from everywhere. They were all at a very high standard. And everybody was accepted. Didn't matter what their skin color was or what their religion was. The only thing that counted is, how is your brain? Is your brain working well? Taking care of your patients properly? And are you ethical? That was it. And that's the only standard that had to be reached. And we stuck by that all the time. I think a lot of that became diluted as time went by. And, hospitals are not immune to what goes on in the general population and in the world at large. And all the different things that are playing out right now, today, they were around us then too. But we ignored them in this little insular place that was Sinai. And the only thing that counted was, did you do your work properly? You take care of your patients right? Did you do the right thing? And what you did, was it of a benefit to someone other than yourself as well as to you? If it was, you have a pretty good day. To me, that was Sinai.
All right. Well, unless you have any other points you'd like to add, I'd like to thank you for your time today, Dr. Clayman.
You are very welcome, Brian. Thanks a lot for having me. Take care, man. Have a